HPV, human papillomavirus, positive test result alongside abnormal cells will require further testing in the form of a colposcopy, a simple procedure to look at the cervix. It is a very similar process to the smear test, but it will take place in a hospital. Furthermore, the 15-minute procedure involves the application of liquids to the cervix to highlight any abnormal cells. Sometimes a small sample of tissue, a biopsy, could be removed for closer examination in a laboratory. London's Women's Centre assured it is quite normal for a smear test to identify changes in cervical cells at some stage in a woman's life. How often do you have smear tests? Ages 25 to 49, every 3 years. Ages 50 to 64, every 5 years. 65 or older, only if one of your last 3 tests was abnormal. Evidently, if you attend regular smear tests, the likelihood of experiencing abnormal cells at some stage during your life is highly likely. High cholesterol, 3 colors to spot in your poo. Warning of high levels. This, however, does not mean that the test should not be taken out of fear. It could save your life. If abnormal cells are not treated, they may turn into cervical cancer, the NHS warned. What causes abnormal cells? High-risk HPV infections, which can spread from any kind of skin-to-skin contact of the genital area, can stay in your body for a long time. If the immune system has not got rid of the HPV infection, then it can cause changes to the cells in the cervix. Bradley Walsh Heath, stars silent disease battle, insight B12 deficiency, signs you're dangerously low, advise the vitamin supplement that may raise cancer risk, tips, these abnormal cells in the cervix, at a later stage, could mutate into cancer cells. The London's Women's Centre emphasised that the presence of abnormal cells does not mean you have cancer. It does, however, enable health professionals to monitor your health and to take any required action to prevent you from developing cancer. Abnormal smear test results. An abnormal smear can be categorized as mild, moderate or severe dyskaryosis, said the London's Women's Centre. A borderline grade is between mild to moderate dyskaryosis, which will lead to either an additional smear test or a colposcopy. During a colposcopy, where the liquid diacetic acid and iodine are applied to highlight abnormalities, if the changes are confirmed to be mild in nature, then a conservative approach will be recommended. This means healthcare professionals believe the affected cells will go back to normal without the need for treatment. Meanwhile, high-grade dyskaryosis will require further investigation by a gynecologist. A referral to a gynecologist will involve a more thorough examination through a colposcopy. Those with high-grade dyskaryosis usually require treatment to remove the abnormal cervical cells. It is important to recognize that cervical cancer can take up to a decade to develop, so a severe dyskaryosis result does not mean you have already developed it, the London's Women's Centre pointed out. However, even after abnormal cells have been removed, it is important to attend regular smear tests.